Hello, and welcome to Second House Watch, a little program that us here at the Nebraska Legislative Study Group puts on to try and help keep folks informed of the happenings of the unicameral. So tonight we're starting a little bit early. We're starting at 7. We usually start at 8. The nights that we have start at 7, we're going to be doing candidate interviews. Candidate interviews are an opportunity for folks to just kind of keep up to date on the upcoming elections and check out who's in your district and who you can vote for. So helping us out or kind of leading the charge on those candidate interviews is Brooklyn Rosado. Hi, Brooklyn.
Hello.
How's it going?
Good. How are you?
Good. I wanted to point out that we were just having a little chuckle ahead of time because you are wearing the shirt, although our camera doesn't. So I want to give opportunity. Awesome. So that's one of our legislative study group shirts that you can head on over to our website at www.anylegislativestudygroup.com and pick up one of those. So Brooklyn, I wanted to say thank you so much for doing all of the work on kind of the campaign side of the legislature and keeping up with who's running and, different elections and races and dates and all of that, and for setting up these candidate interviews and all. So I just wanted to say thanks, and then I'll kind of hand it over to you.
Absolutely. Thank you, Angie. I enjoy gathering the data for these candidates. So my name's Brooklyn Rosado. I'm one of the co-founders of the Legislative Study Group. And I am super excited to be here tonight to kick off our 2022 election season, with our first candidate interview for legislature, James Michael Bowers. He is running in District 46, which is currently held by Senator Adam Morfeld, who is term limited. So without further ado, I'd like to welcome James. Hello, James.
Hey, how's it going?
Good. Thank you so much for being here with us tonight. And I'm just going to let you go ahead and introduce yourself and let our viewers know what you're all about.
Yeah. Well, thank you so much for having me on. I really appreciate it. My name is James Michael Bowers, and I'm running for the legislature in District 46. I'm currently chair of the Lincoln City Council, representing Northeast Lincoln, where I was first elected in 2019. During the day, I'm a social worker at a local middle school, and I have a private practice located in Havelock. I'm a longtime social worker and a longtime therapist, and this is something that I've been looking forward to doing and running to make some changes for our child welfare system, for our healthcare system, and to make sure that we are supporting all of our residents. So I really appreciate the opportunity to come on and chat and share my vision for Nebraska.
All right, thank you. So to get right into it, can you tell us about your key issues and why you think they're important, are top priorities for Nebraskans?
Absolutely. One of my top priorities is working within our child welfare system and our juvenile justice system. As a long-term social worker, I've worked in the child welfare system for years, and Nebraska continues to have areas where we need to make improvements for our children, our teenagers, and our next generation of leaders. Nebraska continues to drop the ball in accountability of who's providing these services, and continues to drop the ball in terms of service delivery for some of our most vulnerable residents in our state. In addition to that, we also need to make sure that we defend our public schools. Like I said, I'm a school social worker, and prior to that, I worked as a therapist in a public school. And growing up in our public school system, I know how important our schools are. As a social worker, I know that schools are our first, last, and sometimes only line of defense for some of our children in our community. So continuing to try to stigmatize our public schools and to remove funding from our public schools is not an option that our state needs to look at. Our schools have been taking on this extra responsibility for our children and our families because the state has not kept up with what these other systems that should be protections and supports for children and families in our communities. So because those systems are lacking, schools have been picking up the slack. And so we need to make sure that we continue to protect and fund our public schools. In addition to that, improving our healthcare access. Coming from the north side of Lincoln, for those who are in Lincoln and are familiar with the Place Matters data, there are some pretty big health disparities in our city. So I come from an area where our life expectancy is about 15 to 20 years shorter compared to other areas of town. And that's not acceptable. We need to make sure that everyone has the access to healthcare and that everyone has the best health outcomes, and that it should not be dictated by zip code. And lastly, we also need to make sure that we protect our seniors. What this boils down to is, as my mother gets older, I just want to take care of my mom. And I know that I'm not the only one in that situation. We need to acknowledge that seniors exist, and we need to start planning now. Soon our city will have more seniors in our community than students in LPS. And if we don't start addressing that issue on a state level for access, housing, and resources for our aging population, we're going to have a senior citizen homelessness issue and a senior citizen issue with lack of care and lack of resources available. So those are four of the top issues that I look forward to working on in the legislature.
Okay. Staying along the topics of your main issues, what policy ideas do you have to address some of those things that you just mentioned?
Well, I think that a good place to start is not to turn down $120 million from the federal government for rental assistance as we recover from this pandemic. I consider that a huge slap in the face when we have families and individuals that are struggling to remain housed. So I think not turning down federal dollars that are coming in would be a great place to start. In addition to that, we need to make services and resources more accessible to folks in our community. So what does that look like? If you go around on our DHHS's website, if you try to type in Medicaid financial limitations, it brings up this really wonky chart that makes it really difficult to understand and continues to make it hard for folks to know if that they would qualify for these services. It's not user friendly, it's not resident friendly, and we need to make sure that we have an open door policy where if folks are seeking help, that we make it easy for folks to understand what help is available and what the qualifications are, and not make it more burdensome for folks to reach out. I think a lot of people are more likely to start research on their own before they pick up the phone, especially if they're looking for help. And so we need to make this information available for families. In addition to that, as we talk about services being available, Senator Hunt has a really great bill coming through the legislature that would remove the ban for folks that have had 3 or more felony convictions for drug possession or use, that essentially bans them from accessing SNAP benefits. That doesn't help anyone. When we ban these essential services to make ends meet and to survive, we are encouraging people to recidivate. We are encouraging people to look for other ways to provide for their families and to provide for themselves. So we need to make sure that we look at these resources that are available, not only make the information easy to access, but make sure that the requirements are realistic and not unnecessarily stringent or unnecessarily stigmatizing for folks that are seeking help. Another thing that we can do to make services more accessible is Medicaid providers in communities. We have a significant shortfall not only of staff, of medical staff, but also folks that are working with Medicaid and that are Medicaid providers. So what I mean by that is, I'm a therapist myself. Therapists and primary care providers that contract with Medicaid to provide services get paid through the insurance program that's available. So if someone has a Medicaid, they can go see a provider, and then that counts as their insurance. We have a shortfall of providers that accept Medicaid for a lot of reasons. We have a lot of providers that believe that Medicaid has a high burden and is not very clear with what the requirements are for providing services. and what that looks like for making sure that we maintain not only the standard of care, but also how do we keep the records, and how do we seek help when we need it, when we need clarification from DHHS. So providers have been hesitant to take on Medicaid clients into contract with Medicaid, and we need to look at the reasons for that, and we need to make sure that we make some of those changes so we can increase the amount of Medicaid providers for families and individuals that have Medicaid insurance in some of these lower income areas. In addition to that, there was a bill that was passed through the legislature, I think it was like 2 years ago, with Senator Lynn Walls, where there would be a social worker in every educational service unit. I'm glad to see that Senator Jin Day brought forward a similar bill to provide a behavioral point of contact for school districts. Again, it's about making sure that information and access is available for help for folks who are seeking it. Another thing for state policy that we need to make sure that we continue to do is making sure that we fund our local health departments. I've consistently testified in front of the legislature. So I'm also president for the Board of Health for our city and county, making sure that we fund our health departments and provide for that infrastructure, because right now they're underfunded and they're doing the very best that they can, but our state needs to help with the cost of that. So that way these local health departments that have relationships with systems and relationships with partners and relationships with the community can be the point person as it relates to public health. Another thing that I think is really important when we talk about mental health care and workers' rights, Senator Moorfeld has a great bill that when folks have a mental health injury, that is counted as a physical health injury, with in providing that same category of classification for healthcare workers. So there's a stigma between a mental health injury versus a physical health injury. But again, as a therapist, I know that those are very similar. And what I mean by they're very similar is that a mental health injury can be debilitating. A mental health injury does take time to rest and heal up from that. And we need to treat a mental health injury very similar to how we treat a physical health injury. So I rambled on for a little bit, and no one likes a politician that talks too much. So those are just some state policy ideas that I have and some state initiatives that I plan on pursuing in the legislature.
No, that's great. I appreciate your rambling because it really shows that you know your stuff, one. And it sounds like you have a lot of intersectionality as far as like, you know, your experience in education and healthcare, or being a therapist, you know, and social work. So I really appreciate that. And you have some really good policy ideas, and it sounds like you've really thought it through too. So you seem very prepared. So thank you. You're making my job easier.
Thank you.
So I want to talk a little bit more about the senior citizen issues, because I think that's one that a lot of people, like, it's not something that we hear about and talk about a lot. So can you just expand on that just a little bit more about what exactly you're seeing as far as what the challenges are with the aging population? And do you see that like across the state? Is that going to be like a state issue?
Absolutely. As I've been meeting with leaders within our senior healthcare systems and our senior support systems in our community, it's really concerning. Some of these agencies, if they're housing seniors on Medicaid, they're losing $30 per day for each bed that a senior on Medicaid has. And that's not a sustainable business model for some of these acute care facilities or these long-term care facilities if they're continuing to lose dollars when they house a Medicaid senior. So we need to address the pay rate, and we also need to address the regulatory burdens that the state provides on some of these, not only providers, but some of these assisted living facilities and these home in some of these healthcare facilities. So absolutely, we need to be providing standard of care and meeting standard of care, but we need to make sure that these regulations are appropriate and not put in place for no reason. So because bureaucracy can get in the way a lot of times. And I think that we've created a lot of systems where it's about more about trying to meet those regulations that are put in place rather than providing good, solid care. And so, of course, we need to have oversight. Of course, we need to have appropriate regulations in place, but those need to be created with providers and also with folks that would be receiving that care. That's the only way that we're going to come up with a realistic plan to address that need. In addition, we have a severe shortage of nurses, CNA, certified nursing assistants, and rest of the healthcare team. We have a shortage of therapists and social workers, and we're going to have a shortage of physicians also, and nurse practitioners and physician's assistants. And so we need to get serious about what we can do to attract talent and those professions into our state, and what we can do to incentivize people going into those professions. Because right now, there's not going to be enough staff, and there's not going to be enough beds to provide that care, which I don't think is too dramatic to say that we could be facing a senior homelessness issue in our community if we don't start addressing it now. In addition, what we've learned from the pandemic, or what's been brought bigger because of the pandemic under a microscope, is the real issue of loneliness and isolation for seniors. And we need to make sure that we can combat that and address those mental health needs with seniors, because as folks continue to age, they might be getting cut off from their social circles or their families, and isolation and loneliness is one of the biggest issues facing our seniors, and we need to address that issue so that way people aren't aging alone.
Yeah, that makes a lot of sense. And I appreciate that you're young and you're concerned about, other populations outside of that. So staying on the topic of healthcare, can you talk about what you've done as your time as a city council person? What actions have you taken to stand for public health, speaking of the COVID-19 pandemic and so on?
Well, I will say that especially during this COVID-19 pandemic, elected officials really have developed, or at least I feel like I've developed a really strong, solid spine. We supported the health department through the directed health measures. We supported our wonderful health director, Pat Lopez, and stood with her. And we faced a recall over it. But I don't regret any of it, because it's the right thing to do in order to protect our community. I've served on the Board of Health since about 2015, I believe, if I have my years right. And being able to support our health department and getting that firsthand look in how public health impacts our community has been huge. I've consistently testified to the legislature for increased funding. Senator Vargas continues to bring up that bill every year. We're addressing lead issues, childhood lead issues in our community. I signed a declaration proclaiming racism as a public health crisis, to have some pretty honest conversations and to continue to support and direct our health department to continue to work to eliminate the public health effects of racism and discrimination. We also continue to support the developing of maps and data. Good data is worth its weight in gold as we try to look for health disparities in our community, where we try to look for what issues specific groups in our community are facing. So continuing to collect that data. And then also forming an overdose committee as the opioid crisis continues to impact our state and our county. And then also supporting home visitation, which provides lifelong benefits for the children that they work with. I'm very proud of the public health department. It makes it really easy for the staff there, make it really easy to stand behind them all the way. So those are some of the things that we've done to support public health since my time on the council.
Those are some good achievements. As far as like the backlash you faced with all that public health stuff, and I'm sure, and I know it's still going on, like, do you think, or I guess this kind of leads into my next question, how do you think that's sort of prepared you, and what else can you take from being a city council person that has prepared you to be a state senator?
Absolutely. Being on the city council really has prepared me to recognize how slow sometimes it can be to make change in our community. I knew that it was always a process to make change through, the political process and through the legislative process. I've been successful with some other legislative efforts in the past before I was an elected official, but sitting on the other side of it made me realize the work, the time, and the effort and the energy that has to go in to building a case and creating a momentum to bring about lasting change. It's not even so much that someone has a good idea and that's enough to get it done. You have to convince other people to join on board with your vision. And then you have to organize the community. And then you have to be able to present the case and be able to push it forward that way. So it's really helped me develop a more realistic sense of what it takes to pass ordinances and legislation through a political body. It's one of the reasons why I'm really proud to have passed more ordinances than any other city council member, because no one's entitled to another term. And so I really wanted to make sure that making the best use of my time and trying to push through as many improvements to our community so our city could really be the best version of itself possible. And I'm going to take that same approach with the state, working with folks to make our state the best possible version of our state it can be. Some of the things that we've been able to pass on the city council, one of the very first ordinances I was able to push through was a Good Samaritan ordinance that several other municipalities had already had in some states. And that was being able to legally enter a car to rescue a child or a pet during extreme temperatures. So I thought that would be a really good one to start off with as I got used to the city legislative process. And that eventually led to being able to put a prohibition on people price gouging during a pandemic. I think a lot of people remember early on in the pandemic when people were buying up a bunch of hand sanitizer or hygiene supplies and then turning around and selling it for a ridiculous amount on Facebook Marketplace. Like, that isn't the market working, right? Like, someone going in, buying everything and hoarding it, that's not the market working. So we were able to pass a price gouging ban during an emergency declaration, and that was passed with bipartisan support, which I'm really proud of. In addition to that, there's been some other businessy things that we're able to get passed. An example is allowing pawn shops to be open on Sundays. And that again was a way, because that ban was put in place, back when you couldn't buy alcohol on Sundays, right? And so making sure that we're updating all of our city codes. Another thing that we were able to get passed on the city council is making sure that as we were going through this budget crunch, that when the pandemic first started, one of the things on the chopping block was reducing the amount of days that our libraries were open. I mean, I work at the middle school that I used to go to growing up, and I used to go to the library by my school every day. And I'm like, I can't in good conscience vote to eliminate something that I had the privilege of using that kept me safe after school and denying the next generation of Lincolnites that same opportunity. And then there's two other things that I'll go through. Another one that I'm really proud of is directing funding for inclusive parks in our city. I've been working with some really great advocates for folks who have family members with special needs, and creating some park equipment and a park in our city where all children deserve equal access to play. And that has been a really awesome bridge issue. When this first came up in the budget hearing, we were getting these stories, these heartbreaking stories of, parents that would take their kids to the park, but their kids, all they could do is just watch the other kids play. Or they felt like they couldn't take their kids to the park because the parents were in a wheelchair and they felt like they couldn't get to their kid if something had happened. And that inclusive parks funding and that seed funding is one of the things I'm most proud of. But I think one of the top things that I'm most proud of is getting the ban on conversion therapy passed in our city and being able to lead the charge on that. So no youth has to go through this horrendous practice of going through this therapy, quotation marks therapy, right? Going through this practice that's damaging and increases the likelihood of suicide, mental health issues, and substance abuse. Being able to help put an end to that in our city was one way of trying to do the most amount of good in the little bit of the corner of the world that we're able to do. And I can't wait to fight for that on the state level.
Congratulations on all of those accomplishments. You have a very impressive resume. I want to talk more about the equality before the law, and just exactly what you just said. What do you think? You said you want to take it to the state level. What do you think is currently lacking in state policy, and how do we get that done at the state level in Nebraska?
Absolutely. Lincoln recently updated the Title 11 municipal code, which deals with equal opportunity. And the crux of the issue really seems to be protections for LGBTQ folks in our community. And we still don't have that on a statewide level. And the trend is that states and municipalities are bringing this forward and they're getting it passed. We will get there one day. We will get there where where LGBTQ folks have this same access to protection and have the same ability to lead their lives and to not be discriminated against in terms of housing or public accommodations. And we will get there someday. It's disappointing that we haven't. But I think that we need to keep pushing that forward, and we need to keep building those relationships. And we need to continue to keep electing out representation in order to share their stories. I've noticed that it's a lot easier to talk about people than to them. And being able to share our lived experiences, people that come from diverse backgrounds, being able to share our stories makes it more real for those that are in opposition. So being able to share my stories as a gay man has really been an asset in bringing people on board with some of these protections and helping people understand that discrimination does still occur. I still walk down the street and people will shout out homophobic words or some really bizarre things. Like there was one time I was door knocking and someone had torn like 3 of my pictures and put them on the thing, put it like an upside down cross on my forehead. Like these really crazy things that have happened. And being able to share those stories, I think, helps people understand that these things still happen in today's day and age, and that is why we still need to act. We take for granted, or the perception is that that things are a lot better for the next generation. They're facing the same challenges, and we need to continue to push forward because the next generation of kids, they can't go through what we went through, and we need to make that change. So we need to continue to fight for that on a state level.
Definitely. And we definitely have to have representatives who, look like the state of Nebraska more. Okay, I want to touch on a topic that is really important to a lot of our members, and it's about the current situation with the overcrowding prisons in Nebraska and the battle to get the funding to build the new prison. And you have stated that Nebraska needs to find more alternatives to incarceration. What approaches do you think state legislators need to consider?
I think that we as an electorate, and I mean those that vote in folks into office, we need to elect folks that aren't going to continue stigma of folks that may have an experience with incarceration. We still see folks who say that they want to get tough on crime, but not resolve why that crime happens in the first place, or how do we prevent people from recidivism, and how do we prevent reentry? And that's not going to be solved with fines, and more jail time. So we need to elect people who get it, and people that have this philosophy of getting to the root cause of what causes a lot of these issues. And, in addition to that, I think that anytime that we talk about overcrowding in prison, we definitely need to make sure that we are addressing the racial disparity in our prisons. And we need to take that into consideration about how we can fix that. Because if we don't have that conversation and we don't address the racial disparity, I think that we're just going to be treating symptoms and not getting to some of the big issues that leads to some of the biggest issues in our criminal justice system. I was looking at some statistics earlier, and it was Iowa has 245 people per 100,000 incarcerated. Nebraska has 278, which where's the pride at in that? Where is the saying that? Where's our values at in that? Having the most amount of people locked up isn't something that we should be proud of. Having the most amount of people that can live productive lives is something that we should be proud of. And so just saying that we're going to throw everyone in jail or throw everyone in prison, that's not a Nebraska value when we break it down. I do believe that we need to continue diversion and add funding to diversion and restorative justice practices in our state. No one should be denied justice or access to due process because of an inability to pay. That's just a financial issue, especially as we see, we even have folks talking about inflation right now and how people are bringing home less money, and a person's financial status should not impact their ability to be able to be represented and impact their ability to have the same outcomes as anyone else when it comes to the criminal justice system. We need to make sure that we're funding alternative courts like drug courts and mental health courts, and allowing that as an opportunity for people to get supports. And we also need to make sure that we're investing in reentry back into the community. There was a topic of conversation, an ordinance that we dealt with on the city council called there's a housing issue with a reentry issue called Alternatives to Incarceration Facilities. And there was a lot of pushback from people wanting these in their communities. And my response to that was these folks deserve access to housing. And realistically, they would be coming out of incarceration anyways. And so being able to help provide people with supports those first couple of months out of incarceration really is crucial to preventing recidivism. And so if we can invest in reentry, make sure that we're helping, providing funding for folks to get job skills and find social support and healthy social support, because they might be starting their lives entirely over, I think is going to be really, really crucial.
All right. Well, you've done a really good job of covering all the topics I wanted to hit on. I think if you want to, we didn't really clarify, so I want to make sure people know that your district is what area of Lincoln exactly?
Yeah, so it's North Lincoln. With redistricting, our new district is essentially the Belmont area, Havelock, East Campus, and the university. So essentially North Lincoln is what District 46 covers.
Okay. And just a reminder for those watching again to check your district. We had the link going up to see where what state legislative district you're in, so people know if they can vote for you. But of course, anyone can contribute to your campaign or be a volunteer on your campaign. So if there's anything else you want to tell us about yourself, or if there's any questions in the comments, which I don't see any yet, but otherwise just let people know, your website and how they can help.
Absolutely. So my website is Bowers for Nebraska, and that's FOR, BOWERS, FOR, NEBRASKA.com. I really hope I didn't misspell that because I think that'll just get played on a loop as an attack ad later. But yeah, I'm so thankful of all of the support that people have provided to this campaign. It's not about me. Campaigns should not be about the person. It's about the issues that we share as a community, the values that we share as a community, and where we want to, what direction that we want to take. So I'm incredibly thankful for everyone that's been supportive and everyone that's either volunteered or donated. It really means the world to me. A lot of this is getting the message out. Getting the message out, not about who I am necessarily, but about the issues that we care about. Getting the message out about the importance of expanding healthcare and how we can do that. The importance of pushing the message out there about how our public schools are saving kids and how we need to continue to support the educational staff and team. Because if we take that away, kids won't have some kids won't have anywhere else to go. Making sure that we push the message out about why we need to start planning for our increasing aging population, and making sure that we have the resources to push the message out about why we need to repair our child welfare system and how we can do that. So that's what donations go towards, and that's what the volunteer work goes towards, is being able to push these messages out. And if anyone ever has any questions, please feel free to reach out anytime. I feel very fortunate to have to be working with a great team. And as always, I'm always open for any questions, or if anyone ever wants to chat, I'm always here to listen.
All right. Thank you so much again. I wish you the best of luck. You seem like you're incredibly qualified and you really know your stuff, and you definitely know how to go about passing policy and what it takes. And good luck. And thank you again so much for sharing with us tonight.
Hey, thank you so much for having me on. I really appreciate it.
Yep.